Tuwing Hunyo, pinagdiriwang ang National Kidney Month bilang paalala sa kahalagahan ng ating mga bato sa ating katawan. Ang ating kidney bato ang naglilinis ng dumi mula sa ating dugo. At kung hindi natin ito maalagaan, maaari ito magdulot ng mga komplikasyon na maaaring makasira ng ating mga bato. Ngayon sa Well O'Clock, kasama natin si Dr. Eliza Navarro, isang nephrologist sa Our Lady of Lourdes Hospital upang pag-usapan ang ating mga bato at itong halaga sa ating kalusugan.
The kidneys are very vital organs. They're just very small. It's about the size of our fist o yung kamao natin. But they require at least 25% of the total blood flow. So that gives you an idea of their overall function in the overall health of our body. So their main function is excretion through the formation of urine or ang tinatawag nating pag-ihi, okay, in layman's term. So all the waste products that our body forms on a daily basis, our body gets rid of that through urine. This plays a part in homeostasis or yung tinatawag nating balanse ng katawan. So balanse ng ating electrolytes, the sodium, potassium, calcium, acid-base balance, and excess fluid also, and excretion of excess fluids. So our kidney is also important for blood pressure control, osmoregulation. And one vital function of our kidney is erythropoiesis. Erythropoiesis means formation of new red blood cells. So ito po yung tinatawag nating pula ng dugo para hindi po tayo magka-anemia. The most common kidney disease is still chronic kidney disease. And this is caused by diabetes mellitus, which accounts for 40% of total prevalence rate. So the prevalence rate in our country is unfortunately higher than most global rates, which stands at 10 to 14%. This is just a sad statistic. So the other causes of chronic kidney disease, aside from diabetes, is hypertension, chronic glomerulonephritis, and most patients who have chronic kidney disease develop it later in life. Most are women, and most of them are in the late stages of life, like 60 to 7th decade. Many Filipinos now who have chronic kidney disease are already on dialysis. And as of 2024, more than 5,000 patients already are on dialysis. Many of them cannot avail of the definitive treatment. And that is why the World Health Organization has tasked the Philippines to be more active in curbing the natural etiologies or causes of chronic kidney disease, which mainly, as we stated, is diabetes and hypertension. So another common cause of kidney disease are kidney stones. Given the type of diet that we have in the Philippines, this is quite not a surprise because we have a high protein diet. So many Filipinos have kidney stones, and this recurs around 3 to 5 years. And the recurrence rate, even if we've had surgery or have treatment, recurs 35 to 40% in most Filipinos. Sadly, there is no specific treatment for chronic kidney disease. And the most definitive treatment modality we have is a kidney transplant. Globally, that is what is recommended. But sadly, because of we are a third world country, so this option is not really a viable option for many of our patients due to its high cost, the lack of donors, and we lack a systematic and organized framework with our national government for patients to avail of this treatment. So many of our chronic kidney disease patients still end up on dialysis. And as we mentioned, the rate of dialysis, patients on dialysis increases every year. It has been seen that one Filipino develops chronic kidney disease every hour, or 120 million population per hour. So that's a very alarming statistic. So aside from kidney transplantation and dialysis, we always advise patients to try to do preventive treatment and to delay the onset of chronic kidney disease. There are 8 golden rules that we advocate for our patients. So one is physical activity. Okay, so staying fit and active will always keep your weight down and will also address the underlying problems, specifically diabetes. And we also advocate for a healthy lifestyle and healthy diet, specifically because Filipinos have a high salt and high fat diet. We also advise patients not to self-medicate. That has been the culture for so long when patients buy medications online. So we tell patients not to self-medicate, especially for supplements that are over the counter. Another important thing is to maintain adequate fluid or water intake. And then exercise, diet, and to avoid vices like smoking and alcohol. And last but not the least is to always go to your doctor for a regular checkup, especially for those who have risk factors. So if you have diabetes, if you have hypertension, your doctor will be able to help you and give you specific medications that will help control all these comorbidities.
Salamat sa panonood. Kung gusto niyo pang matuto ng ibang kalamang pangkalusugan, huwag kalimutang i-like at i-follow ang official Facebook page ng Our Lady of Lourdes Hospital. Hanggang sa muli, kita-kits tayo sa susunod na episode ng Well O'Clock, kung saan well ang well-informed. Para sa mga katanungan tungkol sa inyong kalusugan, tumawag lang sa 8716-3901 Local 1205.